I was here in Palm Beach County, and we are in the beautiful Mandel Library, which I built when I was mayor. Welcome back, Lo. Okay. Anyway, today we're going to have I hope a robust discussion on some new developments in Florida in regards to vaccines. And I have this fabulous panel. And what I'm going to first do, we're going to go around the room. You're just going to give me quick your name and what you do.
Gordon Longhofer, President of the Palm Beach County Classroom Teachers Association.
Dr. Leslie Diaz, Infectious Disease Medical Director for Frankel.
Charmaine Postal, Parent Teacher Association, Florida PTA Board Member and County Advocacy Chair.
Attorney Edwin Ferguson, School Board Member.
I'm Dr. Hila Beckerman. I'm a pediatrician located in Delray Beach and servicing South Florida.
Good morning, I'm Tommy Scheckman. I'm a pediatrician with multiple offices in Palm Beach County. I'm also the former president of the Florida chapter of the American Academy of Pediatrics and a strong advocate for immunizations with lots of involvement in that arena.
Good morning, I'm Kelly Skidmore. I'm a state representative for Boca Raton, Delray Beach, and Boynton Beach.
Okay, well, what brings us here? On September 3rd, that's just a few days ago, Florida Surgeon General Dr. Joseph Ladapo, sorry, let me start over again. Okay, that was not good. So why are we here? This is for my Facebook. Why we're here? Listen, on September 3rd of this year, Surgeon General Dr. Joseph Ladapo and Governor Ron DeSantis announced plans to eliminate all vaccine requirements across the state, including for K through 12 schools, daycare, college housing, and nursing homes. We would be the first state to do this. So we're talking about vaccines to prevent things like tetanus, polio, measles, mumps, chicken pox, more. You guys will get into that today. And the numbers are impactful. Remember this, Florida is one of the biggest states in the country, over 4.5 million children, 280,000 right here in Palm Beach County, millions of seniors, and hundreds of millions of visitors, including 50 million a year to Disney World. I want to also mention to you that the United States Supreme Court has actually ruled multiple times that government can require compulsory vaccines for public health in Florida, and all 50 states, including our state, has done this for many, many years. Dr. Ladapo calls vaccine mandates immoral and compares them to slavery, arguing for parental choice, and I guess that's what he thinks is the right thing to do. Anyway, parental choice. In a recent interview, I think just yesterday, he said that his team did not study what impact any vaccine mandates in the state would have in regards to the spread of disease, because he said this is all about parental choice. Apparently, we'll get to Kelly Skidmore later, but it is Florida law that actually requires vaccination, but, and there is a big but, apparently DeSantis, actually through the Surgeon General, can by administrative action strip individual vaccines from the school entry list, meaning that school children will no longer be required to get them. And from news reports, it looks like the rule-making process has begun. It takes about 90 days to make a rule. So I'll give you my opinion. To me, eliminate, and I'm a grandmother, raise a kid, have two little grandchildren, and to me this is a reckless and dangerous policy, putting everyone at risk, not only our children, seniors, the people that they come in contact with, people with weakened immune systems. It threatens the health of all of us, as well as our economy. Because, look, we depend on being healthy, and we depend on tourists feeling safe. So That's why I have gathered these people here today, because really, you guys are really experts. I want us to really see what you think. We've introduced the panelists, and let's talk about this first. The history, the safety, the efficacy of vaccines. Let's start with our doctors giving us that. Who wants to kick it off? Kick it off. Dr. Beckerman, you said you've been doing this a long time. Give us some insight into all this.
So, thank you, Lois. Let me just, from a personal side, I have been practicing pediatrics for 40 plus years. So I have seen the devastation of what happens when children, adolescents, and adults come down with what we now know that are preventable diseases. It wasn't that many years ago that I was woken from my bed at 2, 3 in the morning to telling me that I had a child coding and dying in the emergency room from Haemophilus influenza. That happened time after time after time. Same thing with pneumococcus and meningococcus. The devastation of seeing children losing arms and legs, becoming incapacitated, brain damaged, and then the burden of having to see a child and manage a child, and for parents, it's absolutely horrifying to have a child who is now totally different. And that burden of caring for this child who no longer may have cognitive skills, motor skills, but more important, is still alive and loving. But the cost, not only the emotional cost to parents, but the cost to society. Because remember, children are our most valuable resources and tools for the future, but we want to be able to also know, we need to know that children are the ones that spread the diseases. Just because they're children, they have very little natural immunity. And so it's going to, as Congresswoman Frankel pointed out before, it will impact every member of our society. The burden of taking care of children and adults is very concerning, and we saw that, and it hasn't been that many years. So stopping vaccinations is a critical thing that we need to all stand up and protest and prevent. Go ahead.
Okay, with that, I'm going to turn to our infectious disease specialist, Dr. Diaz. A little history also in terms of what kind of diseases and in the numbers have been prevented because of vaccines.
Thank you, Congresswoman. We don't have to go too far in history to answer that question. COVID epidemic has dwindled down to cases that I can count in my 2 hands, mostly older population or the immunosuppressed, etc. Why has this happened? There's only one answer to that question, because we all got vaccinated. Vaccines have that power to do that. Not only do they have the power to reduce the cases of preventable diseases in the community, it also has the power to reduce the mortality or death rates associated with these preventable diseases. So when a person comes in now to the hospital and I take care of them with COVID, on a very rare occasion does it lead to their demise.
Okay, let's talk about some of the diseases, the childhood diseases that I know. I remember when I was a kid, my parents would try to get me, we didn't have vaccines, so they would try to get you exposed. I don't know if that was a good idea or not, but let me get back. Let's go. We have another pediatrician here. Where are we going? Over here. Mumps, measles, chickenpox. Oh, it sounds like, are those really dangerous? Why do we need vaccines for those kinds of illnesses?
So I would like to point out that mandates work, and we know that they work because before we had mandates, we had outbreaks of mumps, of measles, we had pregnant women miscarrying. We know that mandates work because as soon as we put them into effect, vaccine rates dramatically decrease. So we know they work, and we know that when we lift mandates and when we make vaccines a little more optional and more exemptions occur, then we have outbreaks. And the way to control outbreaks, there's only two ways, either institute mandates or quarantine. So you're back at mandates again. So I'm not sure why we're messing with a system that has worked amazingly for the last 100 years in the US and for the public school system. These are diseases we don't want to be seeing, we don't need to be seeing. I'm not even sure why we're having these conversations. We already know vaccines work.
Yeah, I think unfortunately we know why. I know that it sounds quite ridiculous. I read some statistics that CDC estimates that vaccine programs have prevented over 500 million of cases of illnesses in the United States since 1994. Now, we're not just, and that's before COVID too. I mean, so we're not just talking about COVID. We're talking about all these child and other diseases too. I'm going to go back to our infectious disease specialists. What are some of the other diseases that vaccines prevent?
There's been eradication of, in certain, most of the world, worldwide, polio, measles, until recently. So we have the power to be able to eradicate disease, and not just reduce the incidence of cases and the mortalities, but also to eradicate the diseases worldwide by distributing vaccines not only to us, but also to other countries. This removal of the mandate just totally undermines public health completely. And not only that, it undermines the guidelines that have been put in place for so many years by reputable organizations like the AMA, the IDSA, the American Board of Pediatrics, and so forth. It undermines them all.
Okay, well, sometimes I think about, let's say, the chicken pox. Well, does it just make you itchy? I mean, if I want to get back to our pediatricians again, what are the consequences of untreated, or when you have rampant mumps or chicken pox or measles? What are I know some kids probably recover very well, right? But what happens when they don't?
So, chickenpox is a preventable disease. When I started the practice of pediatrics, we did not have that vaccine, and we saw tons of children sick and missing school for 3 weeks. Parents missed work for 3 weeks. So yes, it is a disease that typically has a relatively benign course, but just missing school, missing work is significant to what happens to our economy, to our education system. But more importantly, just like any other virus, the fact is a certain percentage does kill children. And I've had 2 children who had chickenpox that were misdiagnosed initially, but there's no treatment for chickenpox, even if you make the diagnosis. So it's just throwing the dice. So that's why the lollipop parties that you may remember, oh my goodness, Sally has chickenpox, and everybody would go over there and suck on the same lollipop. So they would get the disease, because the theory is, and that was true, that having chickenpox as a child was a little bit more benign than as an adult. If you ever have to take care of an adult with chickenpox, you'll line everybody up for vaccines, because adults don't handle it well. But we don't want children to handle it neither.
And I want to get over to our pharmacist. You're a pharmacist here, right? Okay. And welcome, Dr. Surreal. Okay. Tell us about the safety of vaccines.
Absolutely. So as pharmacists, we really rely on evidence-based medicine, and we look at the literature. We know for many years a lot of these vaccines have been proven and have helped in a lot of our public health initiatives. And so we're at the forefront when it comes to helping our communities live healthier and better lives. And so we do believe when it comes to certain vaccines that have been utilized through our childhood, we've looked at the data and we are standing behind some of those vaccinations in terms of how they are safe and effective for our populations.
All right, so I think it seems unanimous with the medical people here that it's not a good idea to eliminate these vaccines. Before I get to our I'll call it our lay people here. I do have one more question for our infectious disease specialist, because what does it mean for our seniors and for people who, or let's say, have cancer or they have low immune systems to get exposed to a child who has the mumps, the measles, polio? Wow, I mean, there's a lot of bad diseases out there. Go ahead.
Yes, Congresswoman, I thank you for asking that question, because it kind of plays into what comment that I wanted to make as well. Older individuals, immunosuppressed individuals that are young or old, they all have a higher morbidity and mortality rate when they acquire an infectious disease that is preventable. So what happens is when the mandate is removed, children are more exposed and and the diseases are more transmittable. But there's a ripple effect. It doesn't stop there. They expose the teachers, which are the adults. They expose grandmother, grandfather, aunt, uncle, who are individuals that are older than 65 years of age, which have the higher morbidity and higher mortality with these diseases. What does that mean? They're more apt to die.
So I'll answer the question, because I want you to use your imagination for a second. Most of our kids are probably starting the school year, thank goodness they are vaccinated, but let's say this abolishment of these vaccines go through, and next year we find that they're not. What is the potential impact when you have literally millions of children in Florida who are not getting vaccinated, hundreds of thousands here in our county? What does that look like?
Uncharted territory. Never happened before in the history of medicine. So we're swimming in waters that we don't know what it looks like. My best theoretical statement is that we are not going to get affected immediately, but our children's children may get affected, yes.
I think that a couple things to note. According to recent CDC statistics, in Florida, only 88% of children entering kindergarten are up to date with their vaccines. That's a very dangerous, low threshold right now as we speak. Never mind what happens if our current government lifts the mandate. That is in the range, that is in the low range where we could expect an epidemic or pandemic of some of these preventable diseases. And that's very scary. The other thing I need to note is that, yes, I have experience, because I'm probably one of the oldest, if not the oldest, on this panel, but most physicians today have not seen these diseases. So that's also, we're not prepared or ready for an outbreak.
Well, that's a very interesting point, because doctors today, or residents, are probably not being trained how to deal with these kinds of outbreaks, right?
That's correct.
Do you want to add something?
Yeah.
Yeah.
I just also want to say that our hospitals are full as is, and our medical health system in Florida is completely unprepared to deal with a pandemic of children, adults, immunocompromised coming in with these diseases. We are already full as it is. So it would be a total disaster to eliminate the mandates.
Okay, it's getting scarier by the minute. So now, I'm gonna have this mic go down. I want we got a lot of folks here really who work in the school system. I want you just to give us your perspective of what this would mean to the teachers, the school system. We're going to start with our
Teachers union.
the teachers union. This will be very official today.
This is bad. Yeah, Gordon Longhofer, president of the Palm Beach County Classroom Teachers Association. I usually come with a built-in PA system. I've already had, since this occurred, some teachers reach out to me by way of email with concerns about what is our position as teachers on these types of mandates. I first want to point out, teachers are by their own desire, their internal motivation, a calling, if you will. They're already community-minded individuals. They seek the best for somebody else on a daily basis. And where their students are concerned, they're primarily interested in making sure every one of those students learns all that they can in the time that they have. They also know that the best way for that to happen is for students to be able to attend school regularly and be in the presence of a highly qualified teacher every single day that they're in class. Anything that begins to undermine that is going to damage ultimately student achievement and their opportunities for the best life possible in the future. And I think it damages our next generation of leaders as well. That's a key concern. But as teachers, we also trust the science. And there are better experts here than me on the science. But it is clear that the overwhelming consensus and evidence in the medical and scientific communities is preventable diseases, when they are prevented, and now primarily by way of vaccines, when they're prevented, students attend school more regularly, better opportunities for student achievement, better opportunities for their best life as adults. And when the day is done, that is really what teachers are looking for, is to have that opportunity. The side benefits are good. We get to stay healthier and work longer. But it still is not for our own selves. It is for the students that we serve and the families who entrust their children to us on a daily basis.
Mr. Longhopper, let me ask you this. What do you think would be the impact on either teachers resigning and or recruitment?
I think it's a given that when you continue to tax, and already, and not necessarily for normal taxes, but when you continue to stress an already stressed employee group with requirements that would inhibit them going into the profession, they're going to look for other options. And when that happens, you've got then new individuals that you're trying to recruit to bring them in. You've got the costs of that continual development of teachers. And rather than go that path, support those individuals with a safe, healthy work environment and a program of public vaccination against preventable diseases that really benefits the community at large. As my colleague down here, the pediatrician, has told us, we're at a threshold number right now in Florida that is beneath the roughly 93 to 95% immunization rate that's needed to literally prevent the negative impacts of preventable diseases.
All right, and I'm getting a little bit more nervous as we go along. We're going to go now to Charmin Postel, who is the board member, and are you the chair, or you're on the board?
So I'm the Charmaine Postel, Florida PTA Board of Directors member and Palm Beach County Advocacy Chair.
Okay, well, why don't we get your thoughts on this? It sounds like we have a potential chaotic, dangerous situation with multiple children at different times getting very, very sick. Tell us, what's your thoughts?
So first I want to say, as a parent of 4 children, 3 that are currently in our school system, I want what every parent wants. Children, a school system that is safe, a school system that is healthy, and that focuses on learning. For starters, PTA has been a long support of parental choice on vaccines. What we cannot support is the suppression of sound medical advice that you guys have given us today, that we have heard since 1989. Our mission is making every child's potential a reality by engaging and empowering families to advocate for all children. And I say that because this policy, these bans, these rhetorics around the danger of policy, or this vaccine policy, is that schools may feel pressured to downplay vaccines. Discouraging families from talking with pediatricians, we're talking with pharmacists, and putting children at risk of preventable illnesses is ridiculous. In Florida, a state with a global tourism economy, the stakes are high. You told us 50 million that visit this?
It's just Disney World.
Just Disney World, right?
143 million.
We can't allow an outbreak that disrupt our classrooms, that disrupt, threaten vulnerable students and strained families. So our goal is simple at PTA. Our goal is to protect our children, protect our students, protect our staff, protect the school system, our vulnerable school staff members that are in our schools, protect our communities. Every child deserves a school system or a environment where they can be safe and they can thrive in that safe environment. That's our goal at PTA, simple. So we say no.
All right, well, I'm going to turn now, it's all going to be on your shoulders, Ed Ferguson, school board member. This is quite a challenge. What do you say?
Well, I don't want to be redundant. Everything that's been said up to this point is factual, but I will say this. I think there's an issue, the fallacy in the Surgeon General's argument, and to the extent the governor has endorsed that, is that he is of the position that parental rights are absolute. There are no civil rights that are absolute. So, respected Congresswoman Frankel stated that lay people are going to talk. I'm not a layperson when it comes to law. I've been an attorney, civil rights attorney for the past 20 years. There's no right that you have in this state that is absolute. Your right to vote is contingent on you not being convicted of a felony. Your right, the First Amendment right, you can't yell fire in a full movie theater. You can't carry a gun into the courthouse. So there's pretty much any civil right that you can think of, it has a limitation. It's always subject to the needs of the whole and of the many. And so in speaking to persons, and I'm sure Rep. Skidmore has more knowledge than me on this issue, my understanding is that ultimately the vaccinations are not going to be eradicated. They're just going to simply try to expand this supposed religious exception, which probably falls into what the doctor was saying as far as the reason why you have 12% or so of children who are not vaccinated. Many people are saying it's a religious matter. But again, Rep. Skidmore probably can speak more on that than I can.
Yeah, I think everybody, that's okay. Everybody should know that now, today, you can get an exemption from a vaccine with a religious exemption, and some of our children do. I just want to get to before I get to Representative Skidmore, I want to ask the pediatrician something because, I'm not sure. Look, I have grandchildren. I can tell you this, and they're very good parents, but I'm not sure how up-to-date parents and grandparents are on what kind of vaccines their children need. You know what I'm saying? And one of the things that I'm very worried about is, you have the Surgeon General talking about parent choice, and I think, I know what you're saying is, well, what about the parent's choice who doesn't want their kid in a classroom full of measles, right? What about that parent, right? And I think there are more parents like that than the ones who, I think strangely, want to put their children's health, make it vulnerable. But this is what I want to know. In talking to parents, how do you, without saying wise, intelligent, at the average parent, what do they really know about this?
So I just want to clarify and strengthen what the gentleman over here said, is that as far as civil rights, every parent still has the ability to decide for their child if their child is going to be vaccinated or not, regardless of what they feel about the safety of vaccines, regardless of the track record. Pediatricians are not making any decisions for these children without parental consent. I have discussed vaccines ad nauseum with every parent. Every parent makes their own decision based on their own child and how well they know their children. But that parent also needs to know that then if their child is going to be in a public classroom, there are going to be consequences. If that parent does not want their child vaccinated, there is no problem with that. The child has other learning opportunities. The child can be homeschooled. They can go to charter schools. They can go to other learning environments that support that same parental philosophy. But the minute you decide that you don't want to vaccinate your child, but you do want them in a public classroom setting, then we have an issue, because then you are providing a risk, you are inserting a risk to the community at large at that point.
Okay, very good point, yeah, Doctor.
So I think it's a great point, but what we have to remember is this. We do live in a society, and vaccines is probably the greatest, besides clean water systems, okay? I mean, if you look at, we have fancy medicine here, we have expensive medicine, but the two things that have had the greatest impact on public health, on keeping children safe and extending their life expectancy, has not only been clean water, but vaccines is always in the top 2 or 3. And I think we have to remember that. I think that it is a public, we all have a duty to society and to our own children. And I think that when you stop vaccinating, and we are at a very low level here in Florida, at a risky level, okay, for our neighbors, for our grandparents, for anybody who's immunocompromised. So one other thing I want to say about the vaccine and religious exemption, there is not a single religion out there that forbids vaccination. And I think we have to keep that in mind. And I think that, you know, other states have philosophical reasons, but the religious exemption is just, to me, an scapegoat by politicians to have some reason to help, you know, keep people quiet. But there is not a single religion that forbids it, because most religions want to promote life, and that's what vaccinations are.
And I think probably disease knows no religion, right? Yeah, did you want to say something?
Yeah, it's I was also just going to add to this the whole concept of herd immunity. And so it's also important to understand that as we vaccinate our populations, even though not everyone is probably vaccinated, but there is a likelihood of the disease itself to be less contagious because there's a lot more people who are vaccinated. And so we also have to keep in mind that as we're talking about the disease spreading.
Okay, so Kelly, I was trying to do some research on this because I was like so astounded that anybody would even have this idea. And I know there is now this is what I read, but maybe you can confirm this. There is a law that requires vaccination in Florida to go into the public schools. But what I read was that by administrative action, where did I write this down here?
I have it.
You have it? Okay. You have it. Okay, I'm going to have you comment on it. That by administrative action, the Surgeon General could strip individual vaccines from the school entry list, meaning children would no longer be required to get them for school. And apparently, as long as they kept one vaccine, they're complying with the law. So I have a couple questions. I think everybody wants to know, what do you think the legislature is going to do with this?
Anybody got a magic 8-ball? Just really quickly, I will clarify. There are 2 places where specific vaccines are listed. In Florida statute, which is where the legislature has control, and in administrative rule under the Department of Health. The ones that are listed under administrative rule under the Department of Health are under the purview of Dr. Ladapo. So those are the ones that are being initiated right now to be eliminated. No mandate for the diseases such as meningitis, influenza, and pneumococcal diseases, right? Those will all go away. The ones that are in law that have to be changed by the legislature are measles, polio, diphtheria, pertussis, mumps, and tetanus. So, Congresswoman, a couple of years ago, I probably would have had a completely different answer, but there's no logic that gets applied to the legislature anymore. There's no litmus test. So what's happening is that there are a group of zealots who are anti-vaxxers, who have gained enough attention and changed the narrative for a political reason. Now, I know that we're talking about religious exemptions. Actually, it's a personal belief exemption. That you don't have to have a religion that says there's a problem with your vaccine or your children getting a vaccine. You don't have to have your child vaccinated. But if we're talking about religion, don't we start with love thy neighbor as you would love thyself? Love thyself as you would love your neighbor? Like, we are about community. We are about taking care of each other. If your neighbor has cancer, you're going to go mow their lawn. You're going to bring them over a casserole. You're going to care for people. That's what we do. And for those who don't think that it's going to happen to you because you're always going to have the choice, they're coming for you. Your peanut allergies, your insulin pumps, your inhalers, those are all going to go. This is where we are. This is a very, very dangerous precipice that we're on. And this is a conversation that is not going to change unless the public outcry overwhelms the zealots.
Okay, so let's wrap up with this. Suggestions. What can the public do if the public listening to this, or when they learn about the push by our Surgeon General in Florida to get rid of these vaccine mandates? What do you recommend people do to push back?
I think the old adage that, you can't change City Hall is that you can, one person at a time. An overwhelming response to the danger of removing the mandate of vaccines is what needs to happen from every corner of the state. And obviously the concern is, once Florida makes this change, who's next, right? And there's just this philosophy that we're not going to get sick. No one's been sick. Well, in the places where there are not vaccines, 3 people have died from measles, right? 2 children and 1 adult in Texas have died from measles. That is not hyperbole. That is not, I'm not making that up. So there has to be, for even those folks who don't have children who are of age to be vaccinated. My daughter's 31. I don't have a grandchild, but guess what? I have 6 great nieces and nephews that are going to be subjected to the diseases of other kids. This is akin to eliminating fluoride from the water, right? Public health is public health. It's for everyone. It's not just your own personal decision, as it has been relayed here. You have got to stand up for your neighbor, not just if it doesn't matter to you or doesn't concern you. This concerns humanity.
Right.
And if you care about it, you will step up. You will open your mouth. You will shout from the rooftop. You will get as mad as hell and not take it anymore.
So I guess you're saying to folks they should be reaching out, contacting their lawmakers, right?
Protesting, contacting.
Oh, now she wants some protests? Okay, we've got a lot of things going. Okay, no, really, this is sort of a dangerous situation, right? Everybody needs to push back. Did you want to add something? Yeah.
Just briefly. So the panel has spoken about this and from a speculative standpoint in terms of what might happen in the future, but it's already happening now. There are spaces inside of Southeast Florida that I know for a fact where you have communities of persons who are already anti-vaxxers, if you will. They have a belief, religious or otherwise, and annually you have large pockets of the population of their schools that are absent for things like measles and things of that nature already. So it's already happening. And the funny part about it, not funny, is that we're only having this conversation on the heels of COVID. Some people feel like there was, social media really did a number on us in terms of COVID. So I feel like there's a conflation and we're throwing the baby out with the bathwater, no pun intended, because clearly we haven't had a documented case of smallpox in how many years? Measles in how many years? We've already spoken about how dangerous it can be for adults to get chickenpox. Isn't it related to shingles in some kind of way? Correct. You're the doctor, but yeah, I read a little bit. At least I stayed at the Holiday Inn Express last night. But no, I think you don't have to speculate. This is already happening on an annual basis. Palm Beach County, Broward, and Miami-Dade, we have pockets in the community where you can set your clock to it, where kids are going to get sick because their parents have already committed to this non-vaccination fallacy. So we just have to continue educating people, whether we do rallies or what have you, just educate people on the facts. It's always about the facts. Be awake, be aware. I know that's kind of a pejorative in Florida, but you should be awake, you should be educated, you should be knowledgeable on all things. And to the extent that you didn't go to medical school or put those 10,000 hours in, you should defer to the scientists, doctors, and all the other persons, pharmacists and what have you, who put in that work for the betterment of this country and the state. Thank you.
One more comment, Congresswoman, if you don't mind. The question that does not escape me that Dr. Ladapo believes this is bodily autonomy. So for every woman in the state of Florida, the irony, the hypocrisy is there for you.
Okay. Yeah.
from a parent perspective, with Parent Teacher Association, just for the numbers, PTA here in the state of Florida have nearly 300,000 members. In Palm Beach County alone, nearly 13,000 members. So we do have a voice every single day during session, committee week. We have parents and leaders, PTA leaders that are at the in Tallahassee, in DC, advocating on behalf of your child, my 4 children, and all of our children, right? So what you can do is you can join that voice. You can join a PTA, whether it's the state PTA or a local PTA in your community, and help us continue to have that voice statewide, nationwide, if you will, to ensure that we stop this mandate and this vaccine thing.
Okay, fine. Anyone else, final words?
Yes.
Go ahead, Zach.
Thank you, Lois. I think the most important message here is this. Vaccines are our most precious resource for our children, for our elderly, for those that are vulnerable. They have proven to be that and clean drinking water are the 2 things. Not all our fancy MRIs and all kinds of different interventions, which are great. But the thing that has led to longer lives, expectancy in living longer, has been vaccines. So I think we need to keep that in mind for everybody.
All right, well, listen, questions?
I don't know who would be the best person to answer
we'll
this.
take questions now.
But this removal of this mandate, what impact could that have on the average family, not as far as affordability with insurance or anything like that? What would be the impact that we could see with that?
You mean, okay, good. You mean in terms of having the vaccine paid for by insurance?
Exactly. So will this mandate have an impact on, if it's going to be covered with insurance, it's going to be affordable?
Want to take a stab at that? There we go.
I've been doing this for over 30 years, and insurances may not be your friends sometimes. And so I'm sure that they will latch on to the fact that the mandates have been removed in order to say, well, maybe we need to start thinking about not paying for it or not covered by the insurance companies, because they've done it before. There's history there. So
The other issue is the Department of Health for those families who are uninsured or are not covered for vaccines. The Department of Health provides those free of charge. That is under the purview of Dr. Latipo. How long do you think it will last that we will be giving those vaccines out to those families who still want them? Probably not very long.
I would also just like to add that I think that I agree. I'm concerned about what this state will do with Vaccines for Children program, which provides free vaccines for those who do not have insurance, and unfortunately that represents about 50% of children in this state. I think that actually one of the things that we are contemplating at the AAP and elsewhere in our advocacy, and I've stood up, we've had some of these threats before. I've stood up in the Florida legislature many times trying to defend vaccines, is that I think for insurance companies, it is, they may not be doing it for the right reasons, but it's the cheapest thing they can do. Because if someone comes down with polio and they're going to take care of them for the rest of their lives, it's freaking expensive. Never mind the humanity, the morality, and everything else. But if it comes down to money, this is the right thing for insurance companies to do.
All right, well, that's a good advice for them. Yeah.
So, I'm just listening to you guys talk, obviously, but can you guys, and whoever wants to answer this, but why is the state getting rid of this mandate? Is it because people aren't getting sick?
Can you explain a second, why is the state doing what?
Getting rid of this vaccine mandate. If anyone wants to answer, is it because they're skeptical? Are they skeptical of?
No, okay, so let me, I'm going to give other people a turn. Let me just say this. The state hasn't taken the action. We have a Surgeon General here and a governor, I think, that have a very extreme point of view. You have a Surgeon General who has said he feels it's immoral for the government to require these vaccinations. His thought is way out of the mainstream, but the governor has put him in charge of the health of this state. So I think it's pretty clear from the people you heard here today, there was no logical, intelligent reason for this. Did you want to add something?
It's a political play. This is just a continuation of everything that's happened over the last 5 years. The government, the federal government, was in support of COVID vaccines, and so here in Florida, we're on the other end of the spectrum, and we're continuing. I think again we've extrapolated this much too far, because if you're trying to repeal back measles, vaccination, things of that nature, that's just asinine. So that's really what it is. We're more focused on in Florida making sound bites than being substantive parties to facilitate information to those who are not in the know. We're more about social media clicks and things of that nature versus being public service. That's my simple statement.
When you say we're more, no. We have a governor.
I'm being benevolent in that regard. Clearly, I'm not going to advocate.
No, listen, I just want to say this. We have, I promise you not to get political here. This is a health issue, regardless of what party you're on. But we do have, it's correct, there's some politics involved when you have a governor who is in a race to the right with other governors in this country. I think that's one way to look at it. But there's no, if you just to summarize what we heard from here, from our doctors, our infectious disease specialists, our pharmacists, our school officials, is there's no logical reason for this.
No science.
No science. Say no science. No science. Say no science-based.
And the president doesn't even support this,
Yeah.
which is interesting.
So is there anything positive that can come out of this? Just trying to be light,
No.
but like is there anything positive?
There's nothing positive that can come out of removing vaccines. But something positive can come out of this discussion today, and with people getting informed and pushing back to their elected officials. That's the positive thing. But don't think there's anything positive about abolishing vaccines.
But this doesn't happen for another, this doesn't go into effect for another 90 days, is that correct?
Well, they're in a rulemaking process for certain vaccines now, but the legislature will have to meet according to our representative. So it's going to be a process. People don't have to panic overnight, but things move, before you know it, we are in the new
Well, everyone is also asking, should I get my titers checked now? All the teachers want to know, do I get my titers checked? How do I know I'm protected? I mean, this has huge ramifications for everybody in the community. We don't know who is really protected and who is not, even if you have been vaccinated.
Okay, the doctors are all recommending that you get your shots.
One more final question.
Yeah.
I know lawmakers will probably meet again, I believe, October or January, but will this be a big topic of conversation going forward?
Our resident legislator here.
Thank you.
It works in the House.
Well, first, thank you everyone for your input today, and thank you for being here, and thank you for the question. Yes, it most definitely will be a battle that happens. And again, not getting political, we're in a super minority situation in the legislature, so one party has the power, right? The minority party is the one that will be fighting back. Some on the majority, hopefully, will join in that fight. Some that have reasonableness in their DNA and aren't afraid to buck the leadership. But it will be a very, very big fight, and that's what I meant earlier about lending your voice to the cause. It isn't just about your own child, or it is about our community, our state, our nation, and how we protect ourselves in the public health arena. And so we need everyone to participate in that discussion.
And just, I will be pushing back as much as I can from the federal level, where we are actually looking for ways to restrain state governments from taking these actions. Sorry.
I actually do have a magic 8-ball. You guys are not going to change the laws that you spoke about before, because the business sector is not going to go for this. We're not trying to have our employees at home caring for a kid with measles and all these different elements that have been eradicated. This is not going to happen. So you have a Surgeon General and possibly the governor who are out in the wilderness on their own, who made this kind of pop remark without really thinking about the long-term ramifications. So I don't think it's going to happen. But this is a call to action for those of you who may not be as engaged as you could be, speaking to your local congressperson, federal Congress superperson like
I'm sorry, you know what?
Reach out to them.
I live in Florida, and we have seen some really bad things happen, in my opinion. But you make a very good point, which is this. It's not only it's not only to be talking to your legislators, but your business folks, people who run camps, people who run daycare centers, parents. They should all be pushing back on our state representatives, right? Good point there. Okay, listen, you guys have been terrific. We're going to save our state, save our children. I thank everybody for being with us today.